welcome to the EADV podcast. In this episode, we are joined by Professor Jan Gutermuth, Chair and Principal Investigator of the Department of Dermatology at University Hospital in Brussels, and Dr. Eugenia Makrantonaki, a renowned researcher with over 25 years of expertise in skin aging at various universities in Germany. Together, they will explore the roles of hormones and genes in skin aging for both men and women, the link between skin aging and neurodegenerative diseases such as Alzheimer's and Parkinson's, as well as the implications for lung and cardiovascular health. Dr. Makrantonaki will also delve into the concept of inflammaging and discuss how lifestyle and stress can influence our skin. Stay tuned to discover how your skin might serve as an early indicator of your overall health.
If you haven't already, check out our program of face-to-face courses offering high-quality theoretical and practical training covering a wide variety of specialties. Places fill out fast, so subscribe to our mailing list if you'd like to be the first to receive news of when courses go live. You can learn more at eadv.org.
And now, enjoy this insightful conversation.
Hello. It's a pleasure to be again with our colleagues who listen to the JEADV podcast. And today we have invited Dr. Eugenia Makrantonaki, who is an expert in skin aging. And Eugenia, you're doing a lot of research in this field with the University of Ulm, but also with the University of Brandenburg. And today we would like to learn from you what is known about the mechanisms of aging. What are some comorbidities or connections? And also, is there anything we can do about it? Eugenia, I'm glad you're here with us.
Thank you very much for the introduction, Jan. And thank you also very much for the invitation to take part in this EADV podcast today. It's a big pleasure for me to be here. Yes, I've been in the research field of skin aging for the last 25 years approximately. I started my research as a PhD student in the Free University in Berlin, examining the molecular mechanisms of skin aging and how hormones can affect our skin cells, how this hormone decline occurring with age can influence our fibroblasts, keratinocytes, sebaceous gland cells. And during that time, I was very lucky that we had this big progress in biotechnology, new methods. And we were able at that time also to investigate the genomic profiling of our skin cells. We had at that time a very good cooperation with the Max Planck Institute in Berlin. And we were very lucky to be the first ones that were also doing the genomic profiling. And we went some step further. We isolated biopsies from endogenously aged skin from females and males, from younger and elderly ages. And we could compare the gene profiling. And it was very interesting to see which were the signaling pathways which were affected by aging and also which genes are important for our aging process. And at that time, we definitely believed that this is also very important to find out these mechanisms because as the skin is also a window to the internal organs. And we wanted also to see whether there is any relevance also to the aging processes in the internal organs at that time. And it was interesting to find out that, for example, the Wnt signaling, which is one signaling pathway which is involved in embryology and also cancerogenesis, is also very important for the aging process. It gets downregulated with age in both genders. And we'll know that both genders age the same with time, no? And very interestingly was also the finding that these genes which are involved in Wnt signaling, they were expressed in the basal cell membrane of our skin. So from this finding, we assumed that the stem cells, epidermal stem cells, play also a significant role for the aging process. And during all this process, it was also very funny and intriguing also to see that genes were also involved in the aging process of the skin. which are very important for the pathomechanisms of neurodegenerative diseases, such as Alzheimer's, Parkinson's disease.
So that's interesting. We have many things. We have the stem cell. We have the impact of hormones. I think all dermatologists are aware of the environmental triggers of aging, like UV light. So the first thing that for a clinician shoots into mind, hormones have an impact. So would hormone supplementation, is this something that at the moment is done in anti-aging treatment for the skin? Is this something that we can do as an add-on to all our other measures, or is this still too early?
There are several clinical studies regarding hormone replacement therapy, especially also in women. Unfortunately, the systemic therapy has been associated with breast cancer, thromboembolic cardiovascular diseases. So we're very cautious about these therapies. However, there are also some topical treatments that are very promising with hormones, such as estradiol treatments, and there are also lots of studies documenting also the effects of the hormones on our skin cells. As I already said, estradiol treatment, progesterone treatment can ameliorate our skin. There is also the dehydroepiandrosterone hormone, which is also very effective in enhancing the skin thickness also, and also making better our skin surface. And melatonin is also among the hormones, which are also very promising agents. So there is a palette of hormones that could be used for the treatment, and with good results, yes.
And this is what you would use topically, if I understand right, to avoid systemic side effects or unwanted extra effects of such a hormone replacement.
Exactly. In order to avoid all this, the topical treatment is very good.
You already said men and women are the same on the hormone level. So do you have similar approaches for men and women, or do you see at the moment more questions from women for such hormonal anti-aging treatment of the skin, or can also men be treated with this?
Men can also be treated. There is also the so-called andropause. It's not very known, but there is not only the menopause for us women, but also the men suffer sometimes from hormone decline. In both genders, dehydroepiandrosterone plays a significant role because it gets down-regulated with time, also in both of us. And what is also interesting is the use of the growth factors. For example, growth hormone, IGF-1. These are also promising approaches, but the clinical studies are not so good enough in order to say that we can start with these factors yet. They also have been associated with cancer and other adverse effects.
Yeah, thank you. And so there are the hormone field is shifting towards topical treatments, and you had it about the stem cells, their role in aging, and the correlation with neurodegenerative diseases.
Exactly, because we could see in our skin cells that genes are expressed which are very important for neurodegenerative diseases. So because it's also logical, because skin and the nerve system both have the same origin. They come both from the ectoderm. So, and we could also regulate these genes with several hormone cocktails, which is also very interesting. I will never forget a good friend of mine, professor in Heidelberg, a psychiatrist. He told me once that he has never seen a woman under HRT, hormone replacement therapy, developing Alzheimer's disease. However, this is also something that we could not recommend anyway, but maybe the dose is the secret in all this. We should not overdose the women maybe with hormones. And because of this finding, we then, in one night, we took the decision to focus on these diseases and to use our skin as a model for investigating them. And for this purpose, we used the iPSC technology, the induced pluripotent stem cells. We took fibroblasts from an old Alzheimer diseased patient, and we transformed them in pluripotent stem cells and then in nerve cells. And we were able to establish an in vitro model of AD, of Alzheimer's disease, which we used also in order to understand better the pathomechanisms of this disease and also check for pharmacological treatments which could influence our nerve cells, our induced nerve cells.
I think that is really interesting, that our skin can maybe give a hint on a risk for neurodegenerative diseases. There's studies that show if you look young, that you usually are also, your internal organs are in a better health status, that our outer appearance of health seems to resemble the inner health. Can we go so far with skin and with skin fibroblasts that we maybe at some point can use this in a predictive model? Would there be profiling possible to compare skin and brain to say this person has a higher risk, or this person should take certain prophylactic measures, anti-inflammation, sports, I don't know. So are the profiles so similar or overlapping?
Yes, in the meantime, we can do this, but unfortunately not for brain. It's not, but for other organs, for other internal organs. For example, there is an association between aged skin and lung aging, and also cardiovascular diseases. And you can measure it by the ages in our skin. There's also some studies on that they have focused on these advanced and glycation products in our skin. The glycation of our skin can give us some hints regarding the aging status of the internal organs. But regarding the brain, it's maybe in the future.
Okay, but that's exciting. Eugenia, that is highly interesting how we now can measure and profile aging. One term that we come across more and more frequently is inflammaging. And since dermatologists are used to treat inflammation, is there a link of a role for inflammaging also for the skin?
Yes, of course. Under inflammaging, under this term, we understand that there is a low-grade inflammation in our skin the whole time. And this kind of inflammation is produced because of the high production of pro-inflammatory cytokines and chemokines. One major factor for the production of inflammaging in our skin is cellular senescence, are the senescent cells. What do we understand? When we say senescent cells, we mean the cells which reach a state that they cannot divide anymore, but they are still metabolic active. And they produce the so-called SASP, the secretory associated senescence phenotype. So these SASP factors, they include chemokines, cytokines, growth factors, and they induce the DNA damage, mitochondrial dysfunction. They influence the protein degradation. They are responsible for the production of reactive oxygen species in the microenvironment. And then it goes further. The extracellular cell matrix gets degraded because of the ROS production, for example, the fibroblasts, which are also in the neighborhood of the senescent cells, get also a lot of alterations. And this is then the reason that the inflammaging is spreading and spreading and spreading. And at the end, the epidermal stem cells are affected and our skin gets aged. So this low-grade chronic inflammation in our skin, which is of course very influenced by exogenous factors like UV radiation, infrared radiation. The visible light has been also associated with the senescence. Is a very important factor for our skin, because we should not also forget that our skin is not only influenced by hormones and by genetics and the endocrine factors, but also by the exocrine factors, by the so-called exposomal factors. And they definitely play a role in the aging process of the skin. There are studies also showing that about 75% of our skin aging is due to the environmental factors, and only 25% is because of the genetics and the hormones.
So that sounds like a good news. 75% is exogenic. That means we can take influence, at least to some point. We all try to promote UV protection. Is there anything we can do? How about stress? Does stress also play a role in aging and maybe inflammaging? Is there something about lifestyle that can be done here as well?
Lifestyle interventions are very important. And stress also stress can influence our skin to a very high extent. There is a very nice review in JEDV by Soraes about how our mind can affect our skin. And there is the so-called also gut-brain-skin axis that he describes very nicely in his review. And he also concludes that stress can, for example, influence the HPA axis, the hypothalamic pituitary adrenal axis, and this in turn can cause inflammation and have very negative effects also for our skin. We have a lot of new knowledge on this topic. And not only stress, but also, for example, sleep deprivation is bad for our skin. Our diet plays a very significant role. Antioxidants, we have to be sure that we have a diet rich in antioxidants. Vitamin C, E are very effective against aging. Niacinamide, vitamin B3. And also in the topical treatment, there are nice studies showing, for example, that niacinamide, vitamin B3 in a concentration of 500 milligram time a day, 2 times a day, can prevent the development of actinic keratosis in our skin. So it's there are a lot of new strategies that we have.
Thank you, Eugenia. We really learned a lot in these minutes. You told us and you explained to us how complex aging in the skin is, that we have an exposome that comes from the outside that contains, for instance, the radiation that we are about, or pollution, but that there's also an internal exposome coming from diet, coming from stress, that aging is related to a low-grade inflammation of the skin, which is modifiable, for instance, by vitamin B3, that we have the skin, as we always knew, is the mirror of the internal organs, but that this goes so far to even like the glycation of our proteins, that our glycation in the skin, for instance, correlates quite well with the glycation in the lung. So the skin as a marker of internal aging, and that we can use topical hormone therapies in anti-aging approaches. So I really would like to thank you. You gave us a great look into such an exciting field, and I think there's much more to develop. Eugenia, is there anything that you would like to add, or a final word that you would like to give to our listeners?
Well, the future is very bright. There are some molecules that are now in the pipeline, the so-called senolytics, the xenomorphics, and a lot of immunomodulators that can target the senescent cells and also influence the inflammation in our skin. And I think in the next years we will really have very big progress in this field. So it's, I'm looking forward to that.
I think that's fantastic. I think most of us are interested in aging, scientifically, for our patients, for ourselves. And I think it's good to hear that there's so much progress made. Eugenia, thank you very much for being with us. And thank you for our listeners for being with us. And hear you soon again. Thank you.
Thank you also very much.
Thank you for listening. And if you haven't already, please make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise you can find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews on other important topics.
Before you go, a quick favour. If you are a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you are interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode. Thank you for your support, it means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.